make the most of your clinical rotations as a psychiatric mental health nurse practitioner student. So the first thing I recommend is reviewing your site's information prior to your first day. So each specific site have different dress codes, time they want you to be there, and sometimes they'll recommend some resources that they expect you to have prior to the first day. So just double check, make sure that you have all your ducks in a row prior to your first day. And the night before, I recommend getting your lunch ready, having your outfit ready, whatever you're going to wear, even if you're doing virtual, and making sure that you have gas in your vehicle, because the less obstacles that you face in the morning, the less anxiety and stress you're going to feel going into your first day of the class. Double check that your alarm's set, and also double check time zones if you're doing a virtual clinical session. So for example, when I was doing my rotation, one of them was actually with a Psych NP out in Florida. So I had to double check my time zone to make sure that I was actually meeting her at the correct time on her time zone. So make sure that you're on time and you are double checking those zones. During your clinicals, write down anything that you're not familiar with or that you're not quite as comfortable with. That way, when you get home, you can take time to research it, look up any information, or fill in those gaps of knowledge. That way, on your next clinical date, you'll be more familiar with that scenario and you'll be more comfortable when you see it again. Don't be afraid to ask questions. That's the whole point of preceptorship and being in this role, is to take time as a student to learn more, build confidence, and get more knowledge from experienced psychiatric providers. So this is your time, this is your time to ask those questions. Being a nurse versus the provider role is very different. So don't be afraid, don't feel like you look dumb. This is your time to gain that knowledge and get questions clarified. Things that I recommend that you be familiar with prior to clinicals are your medication classes, your most common medications for specific diagnosis. For example, depression. What are your most common medications, and what are the most common side effects that you're going to see with those medications? Schizophrenia. What are your most common medications? Same thing. What are your side effects? Same thing with bipolar disorder. That way you kind of have some knowledge and background on the main ones that you're going to see, and clinical should help can start connecting those dots as you see them in practice. Review the components of a psychiatric evaluation, including the MSE, the mental status exam, and be familiar with those terms when you're describing a patient's presentation, because that's going to be very important. Know what AIMS testing is, the abnormal involuntary movement scale. Know what it looks like. Look up YouTube videos so you can see how a patient would present if they are starting to experience tardive dyskinesia, which is very common with psychotropic medications and something that you need to be aware of and catch early as a prescriber. So definitely be familiar with AIMS testing and what it looks like when they start having those abnormal movements. Review your diagnostic criteria in the DSM-5 for these specific conditions as well. This is the criteria that you're even using to come up and formulate these diagnoses based on how the patient is presenting. One thing I recommend is having some kind of book like this one. This is the Pocket Guide to the DSM-5. This is very helpful to have at clinicals. You don't have to get this specific one, but something similar where you can have a quick reference and what that criteria looks like as you're going through your assessment, as you're shadowing your preceptor, and as you're, in your clinical rotation, so you can start building that knowledge as a prescriber. Also, again, I'd recommend having a prescriber's guide. This is the one that I mentioned before. This is Stahl's prescriber's guide. It's a medication guide. You don't have to use this one, but find a good one that you can take to clinicals so that you could reference it to have, your pearls of the medications. And what I like about having one of these is as you're in clinicals, you can even start making notes for yourself when maybe you're hearing like off-label uses or different tips and tricks that your preceptor teaches you. You can even make notes on that, like how are you managing side effects. Keep notes, and this can be like your little prescribing Bible, okay? So when you go to practice, you have those little pearls in there. Along those lines, keep track of any resources that your preceptor is giving you and telling you. I recommend keeping it on your notes on your actual phone, because your notes on paper can get lost, or put it in your prescriber's guide, like take notes in there. But any like websites, any conferences that they mention, any resources that they use, maybe you see some templates or some things that they're using, keep track of those, because once you're in practice, sometimes you'll forget some of these things and pearls that you saw in clinicals. And to be honest, a lot of jobs when you're a new grad, you don't get very much orientation. I know that's true for a lot of people peers that I've talked to, and for myself as well. You're licensed, they expect you ready to go, and you pretty much hit the ground running as a prescriber on your own, even as a new grad, unfortunately. Unless you're in a state where you have like a collaborating physician, most of the time you're on your own. And even when you have a collaborator, a lot of times they may not be available, on the drop of a dime when you need it. So any information and any tips and tricks that you can get along the way during clinicals, definitely take advantage of that. And the last thing I want to say is pay attention, okay? Because I've seen students where they come in and especially if they're doing virtual, they're on their phone, they're not paying attention, they're doodling. This is really your time, and I know even a lot of preceptors are starting to charge for their time. So if you're fortunate to not have to pay for these clinicals, and even if you are, I mean, just take as much information as you can. Respect your preceptor's time because it does take time to take students. Take responsibility, put effort in your studies, research on your own time when you're out of clinicals. All this information is going to make you a well-rounded provider and prescriber. One day you will have your own patient panel and it'll be all on you. And also you're meeting people, you're networking, and you never know that this might open a door to your first position as a psych NP. So definitely don't want to burn any bridges. You want to make a good impression. And I hope that everybody has a wonderful experience. Remember, you're going to get out of it as much as you put in. All right, have a good day.